We've got your picture here. It's a very good picture. And the thing is, you mentioned symmetry. So one thing I will say to you is have a look around in your world or in your family or friends and try to find one person that has a symmetrical face. Because the magic answer is you won't find anyone who's got a symmetrical face. And I think before we were preoccupied with symmetry. And there was this almost Greek hero or Greek heroine model-esque face that was very symmetrical. But what the studies have shown is that actually it's the irregularity, it's the slight asymmetries in people's faces that are what are perceived to be more attractive. So I'd say while I can try to help you to achieve perhaps a little bit more symmetry, trying to chase after an absolute symmetrical face is probably a losing game.
Okay.
But if we have a look at if I'll give you the iPad and you can mark out for yourself what you might like me to focus on.
So I think definitely around here.
Okay.
Yeah. And some definition here.
All right.
And maybe somehow balancing this out a little bit. Maybe a little bit. Just seems a little bit irregular. And see there's some fullness here. So if you're able to sort of create some sort of a hollow here, that'd be brilliant.
Okay.
They're kind of the main areas, I think. Yeah.
Okay. So I think now if we go on to Ben's side profile, we'll have an alternative look at things you might want me to focus on when we do your treatment. So I'll allow you just to have a look and maybe mark out areas that bother you.
So definitely around here. So just a little bit more definition.
All right.
Somehow. Maybe lifting this area here so it's just a bit more of a hollow underneath. The moment it looks really flat.
Okay.
And just to sort of enhance that plane, I think. And definitely here, so more of a projection.
All right.
On the chin.
Yeah. Okay. I mean, interestingly, I think I quite agree. So we have like almost an ideal facial profile where your chin actually comes forward, classically quite a bit more forward, particularly for sort of a more masculine look. And yeah, we can certainly achieve that with a bit of filler for you there.
Great.
But it's one of these sort of dense fillers. So I've actually had it done recently, and it feels like an implant.
Yeah.
And technically, it is an implant because it's very, very hard to break down. It can be broken down, but it takes a long, long time.
Great.
So that's the filler we'll select for here.
Brilliant.
And I also think, if you look here, there's a bit of a shadow here. So perhaps if we try a little bit of a lifting out there. I noticed just underneath your eye, I suppose it's where the cheek blends into the lower eyelid.
Yeah.
There's a little bit of a depression.
Yeah.
And this is, I mean, none of our treatments are really about anti-aging or turning back the clock. They're much more about enhancing your natural attractive features. And I think that is all about making you look a little bit more awake.
Great. Okay.
So I think, yes, as well as adding a little bit of volume here, we can also focus on your jawline a touch more here, and perhaps increase the lateral dimensions of your face a bit there as well. So we'll probably try some filler along the ascending part of the jaw.
Great.
Okay. Perhaps if you want, perhaps a little bit in the lip as well, just to give, because what will happen is once we strengthen the chin, although your lips are quite full in real life, I just noticed here in side profile, there's a little bit deficient volume there. So that will become more pronounced when we do your chin. So perhaps if we put a drop of volume in your upper and lower lip at the same time.
Sure.
Okay. I mean, you'll be very, very swollen for a day or two.
Yeah.
But when that settles down, it will look much, much more harmonized.
Great. Okay.
Okay. And I agree with you. I think if we try some filler treatment to give some definition in the arch of the cheek. So the cheekbone is there, the major part of the bone is there, it's called the body, and then it continues on to join the rest of the skull as an arch. Yeah. And that arch is like a thin piece of bone, but that's what gives that top model look.
Yeah.
And in men, what we do is if we make that quite pronounced and give lots of definition there, it gives an illusion of a hollow just underneath there, which I think is what you're saying.
Yeah, absolutely.
So hopefully that will give you what you want.
Great.
I mean, that's what I would like to do. Basically using some dermal filler to bring some structure and some volume. The other thing I'm going to just show you, sorry, I'm going to go back a bit because there's another picture I wanted to have a look at. which is you when you're smiling. I mean, I think it's quite pleasant when a man has a degree of movement and sort of facial expression, and even some of these smile lines are quite attractive. But I don't know, is that something you'd want to...
I think probably not. I think I quite like them.
You like them as well?
Yeah,
Perfect, good.
So,
we're on the same page, great.
Yeah.
Okay, so other than that, we were talking about doing some structural changes with dermal filler. Is there anything else you think you might like to ask me, or any concerns you might have about the treatment, or any questions at all?
Is it the same product that you use in the chin that you do up here on the cheek?
No. So in the chin, because we're going to be doing the treatment at a different plane of anatomy, and we want it to do something different to what it's doing on the cheek, sorry. We're going to use a different viscosity of filler.
Okay.
So it's all about using the correct paint for the correct part of the painting. So for example, here, just underneath the eye, we are going to use a very, very soft filler. It's often called a skin booster, just to lift out that area without being obvious. But that's going to be the lightest dermal filler that we've got. Okay. But pretty much everywhere else, we're going to be using fairly dense, fairly high viscosity product to give structure.
Great.
Okay. Any other questions at all, Ben?
Swelling?
Swelling. Okay, so if you look at my face, you can see I've got a fair bit of swelling, just here and here, and this will settle usually within about a week's time.
Okay.
And the interesting thing is that being on the receiving end of this treatment, I can tell you what you feel like doing is you feel like pressing it and getting rid of that sensation almost as soon as you've had it done. And however much I'm telling myself that it's normal and it will pass, that's all I can, I can't wait till it's gone.
Yeah.
But, by the thousands of patients that I've treated, I can tell you that swelling usually settles between a week or two, and it really starts to feel much more integrated and much more part of your own face.
Great.
So, here's what we did later. Right, so we're starting, Ben, with Vital Light in the middle corner of each under eye area. We're using tiny, tiny amounts of 0.15 milliliter each side, just to create a little bit of a lift and to make the eyes look a little less sunken. And this was the first time we were doing a treatment, so I didn't want to put too much in. But you can see that it makes quite a nice difference already. Then we went on to give him some cheek augmentation with one of the most lifting products out there, which is made by Restylane. It's called Lyft. It has a very, very good viscosity, and it acts like pillars of support for the cheek area. And we used half a syringe each side with a deep bolus technique, again to give a lift in the cheek contour. Similarly, we used a product called Defyne, which is also made by Restylane, and we used a cannula technique to give contour in the cheekbone. Here I used Defyne again, a very small amount of 0.2 milliliters in each temple to create a more softer journey from the brow to the cheek, and to give a little bit more harmony. Here we're using Ultra 3, made by Juvederms, and we're using 0.5 milliliters, so that's half a syringe, each side at the base of the nose to create a bit of a lift and less of a shadow close to the nose. So now we're using Volux from Juvederms, and this is currently their stiffest, most viscous product, so it's ideal for creating volume and contour in the jawline. And we use quite a lot. We use nearly 2 milliliters of the product spread out across the jawline to create symmetry and to create definition. Here we're using the same product again, Volux, in tiny aliquots at the base of the chin to give strength and contour to this area. And it gives a more strong look in side profiles as well. Finally, we used that product again along the mental crease and with a cannula approach to bring the chin slightly forward and to give more strength again. Finally, we used Juvederms Ultra 3 with a cannula approach to soften the appearance of these troughs near the nose, which are commonly called the nasolabial folds. And in a young person, it's quite acceptable to soften them out and to reduce some of the shadow there. So you could see that the nasolabial folds are lifting out ever so slightly with a small amount of product. Hi guys, so it's been a month since Ben had his treatment with us, and now we're back to hear we're back for him to dish the dirt really and tell us all about what he thinks about the treatment that we did and where we might go from now. So Ben, what do you think?
I loved the result. I thought it kind of exceeded expectations on that front, so really happy. The one thing that was surprising was the minimal downtime. So it was about a day, I think, after the treatment where there was a bit of pain, but after that I didn't have any swelling or bruising. So that was a bit of a plus.
That's fantastic.
I thought they would be.
Yeah, because I think one of the things that we ask you to look at before you have a treatment, and we get you to sign a form. We ask you to sign a form that kind of is a bit of a communication point. And it sort of lists all these common things like bruising, swelling, pain, and it sounds like you've had quite a good ride of it, really. Yeah. Okay, and also in terms of healing, you mentioned you didn't get much bruising, you didn't get much swelling. We did talk before. You had some. You need to take some painkillers. For.
I took painkillers in the night after the treatment.
Okay.
And then the next day.
Okay.
And that was about it, actually.
So not too bad.
Yeah.
Okay.
Yeah.
So would you do it again?
Yeah, definitely.
Excellent.
Yeah, and I want to do more. Yeah.
That's the right answer. Okay. So a next question from me is, you've obviously seen the results before and after. We kind of study our faces a lot more once we've had a treatment. What do you like the most about what we did for you?
I think that I look a little bit more awake when I'm with people, and also that I've got a bit more sort of projection on the cheekbone. That's something that I've always wanted, and it was a really sort of obvious takeaway from the session. And maybe down the track I'd like that a little bit more enhanced, but as a kind of ultimate goal, that was fulfilled.
Brilliant.
Yeah.
And we used quite a lot of products in your jaw as well, because I wasn't sure whether we'd be able to get symmetry for you quite as much as you wanted. But what do you think about, when you look at your face now, do you feel like you've got more symmetry, or is it much the muchness? Or
yeah, I think it's one of those things that's hard to notice, but I do think I feel a lot more confident in myself when I look at myself in the mirror, and I think that's probably a result of a bit more symmetry.
Great. Okay. I completely agree. I think you've had a really good result with the jawline, and I did try to get symmetry for you, but I never promise it, because sometimes it can be quite difficult to achieve. What about what we did for you just underneath your eyes and the temple? What do you think about that? Because
this really, I felt like this sort of woke me up, and aesthetically that really brought my eyes out a lot more. This was kind of a bit of a surprise. I didn't expect that to happen or be part of the treatment. So.
Because I think when I handed you the mirror, I did one side, and then you saw the other side that hadn't been treated. You were like, that's different.
It was really noticeable.
Yeah.
So I recommend that.
Cool. Yeah. And what are we going to do now? Where are we going to progress to? What's your focus now for the next areas of treatment?
I think I'd like to probably bring a little bit more projection to my chin and my cheekbones in the future. But at the moment, I'm pretty happy with the result.
Great.
Yeah.
Good. Like I said, I think this is a good foundation for treatment, and we can build on it. But I think now you just need tiny little tweakments just to get the result sort of maintained.
Yeah.
And that will hold for quite a long time, because the products we've used for you are quite stiff, they're quite viscous, and they're cross-linked in such a way that they don't disperse very quickly. So they're there for a long time.
Great.
And they even build a little bit of collagen for you as well.
Great.
So it's all good news for you. One thing we did talk about at the beginning, and it might be something you want to explore later, is preventative treatment for the upper eyelids.
Yeah, absolutely.
So, I don't know, you mentioned it to me, but this is a treatment that involves a little bit of downtime in the sense that you'd get a little bit of carbon crusts in the upper eyelid, but it tightens the whole upper eyelid area, and again, you would look a little bit more awake.
Great.
So that's the purpose of that treatment. But that's all in the future.
Brilliant.
And we can hit those when you're ready.
That'd be great.
Any other thoughts?
I don't think so. I think I'm just generally really happy with the result.
Well, that's great to hear. There's one thing I wanted to ask you, because everyone's question about dermal filler treatment in particular is the pain that you might experience. And I reckon it actually puts a lot of people off. What do you think?
I experienced a little bit of pain during the treatment, but I was a bit of a wuss about it. And in retrospect, it wasn't really as bad as it may look. But I didn't experience that much pain during the treatment.
So $1 billion question, would you do it again?
100%.
Excellent. That's what we want to hear. Ben, it was a real pleasure treating you at the clinic, and hopefully we'll see you back again soon. That's all for now, guys. We've got a new patient treatment video coming again in 2 weeks, so stay tuned. If you have any questions, any comments, pop them in the comments section below, and we'll see you soon. Bye for now.